Okay, thank you so much, Jitendra sir, and thank you, Mohan sir, and all the distinguished speakers on this beautiful conference that you have curated, Mohan sir. Thank you so much for having me as a speaker. So, just a small introduction. My name is Dr. Radhika Batra. I am a neonatologist here in India, and I am fighting for the same purpose that all the previous speakers have spoken about. We are fighting for equality and justice. So, all of us who work in the development area have understood one thing, that everything is interrelated. Like, we cannot give our children good health without giving them clean water. And that is why the work done by PC Jain sir and the Segal Foundation is of so much importance. And at Every Infant Matters, we try to extrapolate that work by giving children good health in the best way that we know how, by using technology solutions we leverage technology solutions to deliver sustainable impact in the field of maternal and infant healthcare. So, uh, if we look at the problem, the problem actually starts in the womb. It actually starts much before the baby is even conceived. It starts in the adolescent girl. So, I would like you to picture an adolescent girl in a rural setup in India, maybe in Haryana or in Rajasthan. So, this girl is malnourished to begin with. Then she is brought up in a house where the boy gets the preferential treatment, he gets the good food, and the girl often survives on some meager scraps of food or is left to starve. And the sole purpose is to marry her off as soon as possible, and she is considered a burden in the family. So now, this poor girl, when she attains puberty and she starts with her menstrual cycle, her malnutrition status worsens and her anemia worsens. And let's all understand that girls in India in the rural setups are married very early, and soon within their marital days they are made to conceive and be pregnant. So now, when this same anemic malnutrition girl is pregnant, she gets into a further nutritionally depleted state, and her hemoglobin worsens, her health worsens. Is at risk of very severe maternal complications like postpartum hemorrhage and even maternal mortality. If by some reason she survives and the baby survives by some miracle, the baby, as you can see in this picture, is a very small baby, because the mother did not have nutrition to begin with. So the baby did not get enough nutrition, and instead of a standard of 2.5 kilos, the baby is now, say, 1 kilo or 1.5 kilo. And the same baby, because he is in a system of poverty and injustice, doesn't get enough food and turns into this malnourished child, which even at 4 years looks like it is a 1 year old child. Even at 4 years, the weight might be, say, 9 or 10 kilos only. And very often, these children have severe nutrient deficiencies, which I'll be talking about earlier. So, this is a cruel cycle of anemia and malnutrition that eats up our women and our children. And unfortunately, in India, as you can see in this chart, there is severe anemia. It comes in the severe anemia bracket. And India has the highest number of low birth weight babies and unacceptably high maternal mortality and morbidity. So, what our focus at Every Infant Matters to begin with was that I realized, in fact, when I was in my medical practice, when I was studying to be a neonatologist, I was doing my pediatrics first residency, and I was working in a very remote hospital somewhere in the interiors of Uttar Pradesh, and I saw that children who are hungry and malnourished, they are coming with irreversible blindness because of a deficiency of vitamin A. And vitamin A is something that all of us take for granted because we get it in our diet. But these are children who are very, very malnourished. And the problems that in India, the numbers are so high that 75 million children are malnourished, and in the world, 200 million worldwide children are malnourished and are at risk for this vitamin A deficiency that turns 500,000 children blind every year, with the highest number being in India. The sad part is that most of these children who become blind, they die within a year because their immunity is so low because of these micronutrient deficiencies. And of course, as a result of malnutrition, they have poor mental health, they are more prone to cancers. In their adulthood, they are more prone to diseases like diabetes and hypertension. And of course, in India, the health infrastructure is grossly inadequate, and we don't have enough hospitals, enough doctors, and enough nurses, or even enough clean drinking water to give these children. All of it adds to the burden of disease. So, hunger, of course, is not just about feeling hungry. It leads to low birth weight children, and it leads to malnourished children, which ultimately leads to problems like stunting, recurrent infections, rickets, and anemia, poor school performance, poor cognitive abilities, and unfortunately, irreversible blindness that is completely preventable by giving 2 drops of vitamin A. So, why we realize that technology is our best friend is because technology improves access to healthcare, it prevents data fudging, it brings down costs, it enables scaling, it helps in democratization of healthcare, it helps in democratization of training of the government's ASHA workers or the other healthcare staff that is already existing in remote areas such as Kargil and the villages of Manipur and Mizoram. And technology helps us to bridge the gaps where the in the health accessibility. So, one of the interventions that we started, if you remember the cycle I explained, one of the major problems is anemia, which goes undetected. So, we support the government's Anemia Mukt Bharat program by using a non invasive IoT based device to check hemoglobin of all the girls in the reproductive age group, in the adolescent age group, and even in childhood. So, we do this in a very pan population way, and no blood sample is required. It shortens the path from diagnosis to treatment, and the acceptability is higher because we don't need to prick the child or the girl. So it's just like a like one of those saturation probes that we were using in COVID. You just put in your finger, and the machine will tell you a good estimation of the hemoglobin. So it's portable, it's infection free, non invasive, and it's affordable, and there is no wastage of blood. This is a picture of the machine in use in one of our rural setups. And of course, once there is anemia that is detected, the patient is referred to a panel of doctors and treated accordingly, either with iron syrup or sattu powder or nutritional counseling. Or if there is very severe anemia, we refer to the hospital and do an iron infusion or blood transfusion as and when needed. Another technology that we use to tackle this problem is an IoT based low birth weight identification, monitoring, and mapping device. And what this machine does is it helps in prompt detection of low birth weight babies to save lives. So I'll just point out here that all the low birth weight babies that are born, they require certain specialized care, and very often these babies are not identified timely and they don't get that specialized care. As a result, there is a very high neonatal mortality in this low birth weight bracket because of infections and hypothermia and just inadequate care. So basically, a lot of the times, the children that are born in, say, PHCs in very, very remote areas, they are not weighed at birth. Or if they are weighed at all, they are incorrectly weighed and the data is incorrectly there's a lack of accurate measurement. So because of this, the baby is ignored and it's not given the specialized care. So to counter this problem, we developed this IoT based real time remote identification monitoring and low birth weight mapping solution, and we deployed it in primary health centers like you can see. So we did a pilot in 2019 where we covered 8 districts in Rajasthan and we installed 265 machines. We weighed 45,000 babies and detected approximately 37% babies were detected to be low birth weight. And those babies were then given the appropriate care, and it was made sure that this survival rate was much better after the initial detection and segregation into the low birth weight bracket was complete. There was a weekly reduction in the paperwork by nurses that was seen, that was approximately 10 hours, and there was an increased timely supervision and monitoring as is needed. Another intervention that we use is for mental health, and if I were to talk very frankly, in a country like India, mental health is very stigmatized. there is no awareness, there are no resources left for mental health because there are no resources for basics like food and water. So mental health is a very big luxury. There is, even if a person is so mentally unwell that they need treatment, there is no
We can't
money
hear you any
for.
longer. Radhika,
Hi, am I audible? Just a
Yes,
am I the
second.
only one? Other people can hear her?
oh, we
Yes,
can
yes,
hear.
we can
Again,
hear her.
please.
We can hear her. Yeah, yeah.
Radhika, can you speak?
She's audible.
Hi, am I audible?
Yes.
Yeah,
Yes.
yeah.
Having
You are
trouble
audible.
hearing
Please,
you.
Should I
please,
continue?
please,
No, yes, continue.
please
Yes,
Okay,
continue.
continue.
okay. So, of course, we all know that in Indian households where the money is less, it often leads to problems like domestic violence, overworked parents leading to them hitting their children, and alcohol and substance abuse, broken families, and of course, no support structure for these unfortunate broken families. So, to combat this mental health pandemic that is there in the world, we have come up with some AI based counseling videos for mental health. That is My Kahani. And these are made in the local languages and they are deployed in the field by health workers so that, and as you can see, these videos have different topics that cover all the spectrum of mental health diseases. So stuff like loneliness and bullying, how to tackle it when your parents fight all the time, how to combat anxiety and finish your tasks. So, whole spectrum of mental health diseases is covered, and they are deployed house to home in a very democratized manner in slum areas and in rural areas where otherwise mental health would be a very big stigma and just be ignored. So we at Every Infant Matters, we are working in 15 states of India, and I'm happy to report that we are serving the poorest of the poor. We are working in areas where medical facilities are very very scarce. For instance, we are working in District Kargil, where most of the time the villages are under snow, and the temperatures can fall as much as minus 45 degrees centigrade. We are working in desert areas of Rajasthan. We have worked in Sikkim and Manipur in the remote villages, and so on. So we try to in tribes of Uttar Pradesh like Mirzapur, where the people are so socio-culturally isolated that they are not aware of what is good and what is bad for their children. Another coming back to the whole aspect that we try to reach the unreachable areas where the health systems are not very well developed. So the concept is that there are certain PHCs, maybe there would be a PHC catering to 10 or 15 villages, but the staff at the PHC may not be equipped enough to handle a situation like postpartum hemorrhage. So to combat that problem, we realize that we cannot make more doctors in the country want to go and settle down in an area like Kargil. But what we can do is we can train the existing infrastructure, train the existing staff in managing high risk cases and also recognizing danger signs and referring to the nearest civil hospital on time so that lives are not lost in lack of first aid and lack of skilled personnel. So we use this Echo model, which is online virtual training platform. A curriculum is made which includes all the major life-threatening emergencies in neonates and in the obstetric side. And these health workers are trained in batches of 50 to 100. And then after the training, they're given a sort of an exam to make sure that the training has reached them. And at the end of the training in 6 months, they are giving a certification by Project Echo and Every Infant Matters, ensuring that their skill set is now in place and ready to tackle all sorts of problems in the community. So this is one of the offline trainings that we did in village Handarban, which was earlier in Pakistan. And we have been working in remote villages in Ladakh, like village Silakche. We have been training the personnel here. We have been doing vitamin A and deworming distribution. And of course, we have tried to reach as many of the malnourished children as possible. So, before I conclude, I'd like to just talk about our results. And I'm very happy to tell you that we have given vitamin A supplementation from the time we started in 2019 to now. We have been able to save 700,000 children, more than 700,000 children from blindness by giving them vitamin A. And in the last 1 year, we have detected and treated anemia in around 20,000 women, and we have given prenatal vitamins to almost 50,000 expectant mothers to support the pregnancy so that that cycle of malnutrition and anemia and vitamin A deficiency breaks and children don't lose their eyesight and they don't lose their lives. We've been fortunate enough to get a certain recognition for our work by the Gates Foundation, by Niti Aayog, United Nations, and Indian Medical Association and World Economic Forum. But there is a long way ahead, and we would love to partner with any of the other speakers and their wonderful, wonderful projects. We do have a project going on in rainwater harvesting because, like I said, we can't give children clean water without give clean good health without giving them clean water. So I would love to discuss more on that. But thank you so much. That's all from my side.
Very good. Thank you, Radhika ji. Let's say anybody has question or as you think of question, I make a general comment, and that is this taking care of the babies in infancy and the beginning years is a very, very impressive work. My daughter is also a neonatologist, so I know how difficult it is to save a kid at 22 weeks born and those kind of stuff. But we have a different dimension of problem that after the birth of 36, 39 weeks, there are problems. So congratulations for work done well. I have a general comment, and I sit back and see these efforts in a different angle. And one of the thing is in ancient Indian practices, there were Ayurveda and family living, and some of those practices are beginning to come back as a things to do in modern time. So we are following a Western way of preventing problems like vitamin deficiency. And probably those are the very valid thing, and we should continue to do that. My thought is what is from our ancient science and practices and Ayurveda and stuff like that, what is it that we can also adapt that can help solve this kind of problem? Just an open thought to everybody while you have question for Radhika ji.
Okay, can I make one comment, quick comment?
Sure.
Yes, I congratulate Radhika madam, and are you in connect with O.P. Jindal University, Sonapat, Haryana, madam?
No, we are not connected, but we would love to connect. If you can make a connection, that would be great.
Okay, I would like to. We are Academy for Global Business Advancement. We have like some student chapter there, O.P. Jindal University,
Okay.
Global University, and I
Okay.
know that they have the social connect like that, and that could serve as a hub, like a primary academic institution. They network all over India and all. Let us connect offline. Okay, thanks.
Yes, sir. Yes, sir. Thank you so much.
Good question. Thank you. Yeah.
Radhika, also I've sent you in my information to connect on your chat. So if you can do that, that'll be great. Thank you.
Sir, I'm not able to find. Is there
You know,
like a
there's a chat, right? Chat you see in the bottom.
yeah.
Then if you open up, you'll see one for, Dr. Radhika. Do you see DR?
Um
Okay,
no,
I can put it here. That's fine. Don't worry.
I'll just take your details from Mohan, sir, if that's
Okay,
okay to
no problem.
connect.
Thank you.
Okay. Thank you.
Okay. Any further questions, thought?
Yeah, Radhika, I get information that 4 out of 5 Indian males have mental issues from visitors who are visiting India. And also, I'd like you to contact the Rotary Club Prakasham Tata,
because he does projects for anemia, and he may be interested through a nurse at the University of Illinois. Thank you.
That would be really great if you could make an introduction, sir. I would love to connect. And of course, you're absolutely right about the mental health problems being worse in males in India because, as we all know, in the Indian society, the male is always supposed to be the provider. And when he is not able to deliver those providing, results, there's often a mental health uh, issue. And of course, the way the stigma is, especially with the man having to be the strong element at all times, it's very difficult for males to cope in general with their mental health.
Great, great. Radhika ji, just one thought. In India, in bigger cities like Bombay, Delhi, and there is a very good neonatal care, doctors and pre-birth and after-birth thing. Are they engaged in helping you in any way?
So not really. Like I myself also part-time work in Apollo Group, so I have seen that side of the world also. But yeah, if I ask them to take certain classes for the online training, yes, they help in those matters. But aside from that, the doctors who are in Delhi and Bombay don't necessarily want to engage with areas like Kargil and Bundi in Rajasthan or Rewari in Haryana. So they will not be interested in helping.
So there is no trend or precedence like that in any other field other than neonatology. Doctors Without Boundaries. That's a concept where doctors dedicate their time and
Yeah.
go. Is there something like that among
No, it
states?
doesn't exist unless, of course, there are certain medical colleges that have a bond that has to be fulfilled. Suppose you are doing your
Ah,
maybe your
okay.
super specialty from Maharashtra, then you have to stay in Maharashtra for like an X number of years and serve out that bond. But that is not a mandate for every doctor, and you can actually pay money and get out of the bond, which is what most people do.
I see. So that concept of Doctors Without Boundary kind, not just for this, but
No,
any
it's
other
not there
discipline.
in India.
I
No, so
see.
that is why these areas are grossly neglected, and they have one hospital for like 50 villages, and the hospital is far. So, if a lady gets postpartum hemorrhage in the middle of Sundarbans, we can't really help her much until she gets to the Kargil civil hospital. So that is far, and the health worker on the ground should be equipped enough to understand that this lady is starting to bleed now, and I should start the referral process now, so that in 2 hours I can give certain fluids, and I can refer the lady in an ambulance. So maybe by the time she reaches, she will still be in a situation where the case can be salvaged, or else if it's already too late, then she will might not make it.
I see. Okay. So I have general comment for Mohanji as a leader of this team that is there possible to initiate Doctors Without States or Borders kind of stuff has a merit, and maybe there are organizations who can take a look at it. So just a thought. And any other question, comment for this presentation?
Yeah, sir, I just would like to comment on quick comment
Yeah.
on your suggestion.
Uh-huh.
Yes, the National Innovation Startup Policy, healthcare startup and all, like it, we cannot make it mandatory. They can opt out by paying the bond. But healthcare startup, by offering them like a connectivity to startup ecosystem investment like that, we can
Mhm.
connect, and this can be very easily handled through Prakasham Tataji's initiative. I have already plans to like a create with academic institution policy both for engineering and medical college universities. It is the same. I will
Mhm.
definitely look into that, invest, and create the connection. Thanks.
Yeah, very good, very good. Because if I see 1.4 billion population, we have a stratum at the bottom, at the top and somewhere in between, and obviously the bottom one is shrinking, but it is still sizable, like couple of 100 million people who are still in that zone at the bottom. And this kind of sharing, so let the top echelon people know that here is somewhere we need help, and make those connection and accelerate the whole thing for 2047 achievement. Yeah.
Yes, now all these videos are online. We can, create the, sharing platform to organize the effort. And Daughters in India, mostly, like Daughters Without Border, mostly it is busy with all wars salvaging. They haven't gotten free to look into issues like this. We need to create extension.
Correct. Yeah, Doctors Without Border is a concept, and we can modify that for just using it within India.
Exactly, like Engineers Without Borders, Doctors Without Borders, we need to strengthen their process assets to be
Correct.
more powerful. I
Correct.
will connect with you offline, sir. We can elaborate and create.
Sure. With this
My favorite.
AI and technology and internet and all that,
Of
we might
course.
be able to. All right. Thank
Yes.
you.